Bangladesh is in the grip of major measles outbreak. In less than a month, more than 100 children have tragically lost their lives. 900 cases of measles have been confirmed and thousands more are suspected to be afflicted with the airborne disease across the South Asian nation. Hospitals have been swamped with cases, stretching them beyond capacity, while crowded cities and Rohingya refugee camps have transformed into potential hotspots for the deadly disease. Our next report brings you the details.
In a small clinic on the outskirts of the capital Dhaka, a young mother waits anxiously, her child cradled tightly in her arms. The boy's skin is dotted with a faint rash and his body is burning with fever. Symptoms that of late have become all too familiar across Bangladesh. Around her, other parents wait, engulfed in uneasy silence, each holding a child afflicted with the highly contagious disease. The scourge of measles has invaded homes across Bangladesh. The outbreak is one of the deadliest in recent history.
My child had a fever and a cold. Then I consulted a doctor and had an X-ray, which showed pneumonia. Treatment was ongoing for pneumonia, but after 2 days, a measles infection happened.
Hospitals have been inundated with young children aged 6 months to 5 years old, many of them burning with fever, struggling to breathe, their skin marked by the telltale rash. Given the sudden surge in measles cases, the government of Bangladesh has launched an emergency measles rubella vaccine drive. The campaign, which started on the 5th of April, will expand nationwide in phases from next month, aiming to reach over 1 million vulnerable children. Global partners, the World Health Organization, UNICEF and Gavi, the Vaccine Alliance are working alongside local authorities in 18 high-risk districts in a bid to contain this outbreak. For a country of over 170 million people, the sharp rise in cases, putting the youngest and the most vulnerable children at risk, has set off alarm bells. Since mid-March, over 7,500 suspected cases have been reported, out of which more than 900 have been confirmed. Compare this with the fact that last year only 125 cases were reported, rendering the current situation both shocking and devastating. Dense urban areas like Dhaka and regions such as Cox's Bazar, home to the large Rohingya refugee camps, are especially vulnerable. Crowded living conditions make containment difficult here. But what is even more worrying are infants too young for routine vaccination. Especially vulnerable, they are at the highest risk of severe illness.
They should avoid taking medicine from shopkeepers unnecessarily. If a child has a fever, especially high fever, they should not rely on medicine from local shops. Instead, they must take the child to a hospital as soon as possible.
Noteworthy is also the fact that measles is one of the most contagious diseases known to humankind. An airborne disease, it spreads through air, causing fever, respiratory distress, and a characteristic rash. The virus remains active and contagious in the air or on infected surfaces for up to 2 hours. In certain severe cases, especially among young children, it can lead to fatalities. According to the World Health Organization, at least 95% of the population needs to be vaccinated to stop the disease from spreading, rendering the role of vaccination crucial. Bangladesh, despite decades of progress, has not reached that threshold. Since the launch of a mass immunization campaign in 1979, Bangladesh has made rapid and remarkable strides, raising the coverage of fully immunized children from just 2% to 82%. So how did the South Asian country, long regarded as a model for vaccination programs, find itself grappling with one of its deadliest measles outbreak in the recent years? Well, it hasn't helped that special nationwide measles campaigns, typically held every 4 years, have not taken place since 2020. First, the COVID-19 pandemic disrupted health services, and then came the political turmoil of 2024. During this period, the vaccination campaign for measles was disrupted. planned campaigns never materialized due to political paralysis. Consequently, there was a shortage of critical vaccine stockpiles, including vaccine for measles and 6 other diseases. Responding to questions in the parliament on Monday, Bangladesh's health minister pinned the blame for the outbreak on the mismanagement and failures of the previous administration. But for families anxiously waiting outside overcrowded clinics, the question of responsibility matters less than the urgency of the moment.